Good evening, Sharks. Thank you so much for Skyping in with us today. We so much appreciate your time and willingness to listen to us and our ideas.
Today, we're going to be presenting our product called the First Steps Flipbook.
Glad to be here.
As SLPs, we're often presented with clients who have multiple communication needs. They struggle in areas like written and verbal communication. So what do you do, Gracie?
Well, everyone deserves access to communication, so I'm thinking alternative and augmentative communication, otherwise known as AAC.
What is alternative and augmentative communication?
We're so glad that you asked that question.
According to the American Speech Language Hearing Association, otherwise known as ASHA, AAC is when you use a variety of tools and techniques. These include picture communication boards,
Line drawings,
speech-generating devices,
tangible objects,
manual signs,
gestures,
and finger spelling. All of these help the individual communicate their wants and needs, including their feelings and ideas. These conditions include, but are not limited to, autism, cerebral palsy, dual sensory impairments, genetic syndromes, intellectual disability, multiple disabilities, hearing impairment, disease, stroke, and head injury.
ASHA also says that the main difference between augmentative and alternative is that augmentative is when the communication is manipulated to supplement the existing speech.
And alternative communication is when you use it in the place of speech.
Oh, I see.
So now that you're a little more familiar with AAC, let's talk about where our products come in.
We have created a line of small-scale AAC devices that serve as visual supports in a variety of environments for a variety of clients. The First Steps Flipbook can be used in a therapy session, classroom, or simply at home.
Oh yeah, that's nice.
Our products are personalized to each client and provide vivid pictures and symbols for communication. Clients are presented with a page of their flipbook and can use gestures or signs or verbalizations to indicate meaning. The tabs chosen for our example client Jace include simple 1 to 2 word phrases. However, as mentioned before, the tabs are customizable to each individual client's needs. At the bottom of Jace's booklet, we also have an I want page, which includes a series of nouns that he can indicate that he wants during our sessions.
Oh yeah, I can see that. I like that.
Now we're going to do a short demonstration of our First Steps Flipbook. We're using the I want page. Gracie is my client. Gracie, would you like to sing some songs, or would you like to read a story? You want to read a story? All right, tell me you want to read a story. Great job, Gracie.
We have tested several of our products at the Communication Disorders Clinic at Western Kentucky University, as well as the Clinical Education Complex, also located on the campus.
We have had the most success with some of our goal-setting products and the product we're presenting today, the First Steps Flipbook.
Glad it's working for you, but why should other SLPs use it?
Well, many times SLPs have to ask, how should I introduce the possibility of using AAC with my client?
I'm really glad you asked, Gracie. There's multiple techniques used all across the country, but our product in particular caters to a specific client's multiple communication needs.
The First Steps Flipbook targets a specific client's primary motivator, which helps keep them attentive and alert.
In our example, Jace's primary motivator is animals, just like you sharks.
Thank you so much for tuning into our presentation today. Please consider supporting our First Steps Flipbook. So, what's the offer?